nous parler, justement, va répondre à une de nos questions tout à l'heure, c'est du Lasik au Smile, Reasons to Change. Is it correct? Yes, thank you, Roberto.
Docteur Garcia, j'aimerais vous remercier pour votre gentille invitation et grâce à mon ami Renato qui nous a mis en relation. Sorry, I can't speak French really, so I will go on in English. Yeah. Slides are arriving. Just to tell that over the last few years, I got familiar with Smile, and I found something I would like to talk with you about. Great. So the items I will touch in this presentation are these: the induced aberration with Smile and with femtolasic, the laser tissue interaction, and the epithelial and stromal response, especially the epithelial response. You already heard about the cosine effect that does not exist with Smile. This is a minus 7.5 diopter correction with an old laser without the cosine effect correction. And this is what we get with Smile. I hope something will change. Yeah. Because there should be a video, however, not important, because in Smile we have a computer-designed lenticle that is as effective as the best wavefront optimized Lasik. Let's go on. But what I would like really to discuss with you is the laser tissue interaction that's not crucial in Smile. If you think in Smile the optical result will not depend on the laser. The laser is only used, to design the lenticle, and the lenticle itself is the same regardless the efficacy of the laser. If the laser has a low efficiency, we will find it more difficult to dissect the lenticle, but the lenticle shape will not be affected. So this is one advantage of Smile over Lasik that is especially helpful with higher diopter correction, above -4, -5, while probably with lower diopter correction, this is not really influential. And then the corneal epithelium remodeling in Smile. There are few studies published about that. And most studies say that there is no actual difference between Lasik and Smile for the epithelium response to surgery. This was published in 2016, 2018, and very, very little differences. Even recently, the same data were published. However, we see here that the topographic variability, is this the pointer? Yeah? The variation is higher in Smile than in femtosecond laser. The literature shows some contradiction in this point. I hope this works. Yeah. And even recently, Kanellopoulos found similar thickness with both techniques, however, with some lower homogeneity with femtolasic as compared with Smile. For all these studies, a posterior OCT with anterior adapter was used. I have a personal study I would like to share with you. Using an anterior segment OCT, I compared 50 SMILE eyes with 36 femtosecond Lasik eyes followed for 6 months. Probably out of the corneal thickness, we found that in SMILE, higher myopia was corrected. The result about of the endothelial epithelial study, I hope this works. Yeah. Great. This is the central epithelial thickness, and we see that with SMILE we have a lower central epithelial thickness, not that huge amount of microns, however lower, but especially we have a much lower variability in the central epithelial thickness. And we know that sometimes the central thickness is the cause of the regression after Lasik. So with SMILE, we might say that the undercorrection, if any, will not depend on the increased thickness of the corneal epithelium. But more than the central epithelial thickness, how is the thickness profile going in the central corneal area and in the pericentral corneal area? This is the variation in the central corneal area, and again we see the greater variability after Lasik than after SMILE. And the same result applies to the pericentral corneal area, and even more, that is, after Lasik, there are variations in the same eye in the corneal epithelial thickness. And this is the best case I had out of my series. I don't think we can say what is the SMILE eye. The SMILE eye is this one. However, when we go to the worst epithelium images, we really can say that the SMILE eye is this one. This is the worst SMILE eye I had as for the corneal epithelial thickness homogeneity. This variation we see after Lasik in corneal epithelial thickness is not evident in the normal tomography. This is the normal tomography of this eye. This eye has a very thick corneal epithelium, and this is not appearing here. So this is something we should keep in mind when doing reoperations, because sometimes we think that we have an undercorrection and it's all epithelium after Lasik. And so in Lasik we can have normal epithelium, thickened epithelium, homogeneous epithelium, or much different epithelium thickness from location to location in the cornea. In conclusion, SMILE is already better than femtoLASIK for the shape of the removed lenticle, for the lower dependence on laser efficiency, and for the healing of the corneal epithelium. However, SMILE needs refinements. We heard about that, and other refinements will be available soon. Thank you for your attention.
Oui, okay. Donc, thank you very much, Roberto. Yes, question? Yes. Many questions.
Just one. Hello. Thank you for your presentation. Do you think we can treat or have a retreatment of SMILE earlier than after LASIK? Can we have a retreatment after SMILE earlier?
I think so. Actually, the few retreatments I had were performed 2 months after the original smile. And this is why we should go on doing so, because since the corneal epithelium will not mask the result, we can treat those eyes earlier.
Des arguments, Cathy, tu as quelque chose à... Roberto.
Thank you very much for your presentation. We were talking about indication of a smile. Do you now do all your myopic treatment with smile? Or depending on the cornea, we were talking about that before.
Yes, only at the request of patients I do Lasik. There are a few patients who, after hearing that any retreatment would be PRK, they prefer Lasik, fearing for the retreatment. This is the only reason I have now. I feel comfortable with smile, and I'm down to minus 0.75 diopter correction. I treat my 4th son with smile, and on the following day he was 2015 uncorrected.
Oui, on récupère très vite. That's why perhaps for presbyopic patients, myopic presbyopic patients, sometimes I still prefer Lasik, because you can adjust the correction very easily by lifting the flap, and it's a little bit more difficult by smile. That's because PRK sometimes patient doesn't want.
Yes, I treated only a few of those patients, and luckily they were physicians, and so I tried micromonovision, and they were well satisfied with it.
Thank you very much, Roberto. Merci beaucoup. S'il y a une autre question, ok, mais je pense qu'on va